So, Chris, what are some of the common types of breast cancer misdiagnosis errors?
Well, there's really two types of breast cancer misdiagnosis cases. The first um, would be the most obvious, and that's patient has a mammogram or some other kind of imaging, and the radiologist or person reading that study just misses it, or calls it something else other than cancer. The other one would be where a patient goes to the doctor with a lump or some other abnormality in her breast, and the doctor dismisses it as nothing to worry about or not abnormal.
And so, how can a delayed or an incorrect diagnosis, like you were just talking about, impact a patient's outcome?
Well, I think it's pretty commonly known that in treating cancer, that the sooner the treatment starts, the better the outcome for the patient, and the same is true with breast cancer. Early treatment usually leads to a better outcome.
And so, what are then the key elements that a plaintiff needs to prove in a breast cancer misdiagnosis lawsuit? Say they did end up getting cancer. It was now worse than it could have been had they caught it, earlier, and so there was this misdiagnosis. Then in order to prove that there was a misdiagnosis there that you can, go after in terms of with a lawsuit, what do you have to prove?
Well, in any medical negligence case, you always have to prove three things. You have to prove, that the doctor either did or didn't do something that a reasonably careful doctor would have done in the same circumstances. So, in the case that I gave about the patient, going to see the doctor and saying, "Hey, I have a lump in my breast," and the doctor dismissing that or not following up on it, you'd have to prove that another doctor in that same situation would have referred her for a mammogram or to an oncology doctor, cancer doctor. In the case where it was just missed on the mammogram, you'd have to prove that reasonably careful doctor looking at that same or similar mammogram would have told the doctor who ordered it that further follow up was required. Then the second thing you have to prove is that earlier treatment would have made a difference in the patient's outcome. So in other words, if the treatment started earlier, she wouldn't have the same injuries, or you know in the case in case where it involves death, that the patient would have lived had she gotten earlier treatment.
So how do you prove those types of things? Do you bring in, a radiologist who would look at the mammogram scan and say, "Oh yeah, that's absolutely something that I would have, referred to somebody else or called cancer."
Right, that's exactly right. You need to have you know experts in the field that would come in and say, yes, I would have done something differently, and this is what a reasonably careful doctor would do in these circumstances. So either, referred the patient for a mammogram, referred the patient to oncologist, or in the case of the radiologist, yes, I would have recognized that that was a cancer, or at least suspicious enough to require additional testing.
And so when you fail to detect, breast cancer on a mammogram, or like the other example that you gave with, saying that there was a lump that, didn't feel like that was likely to be cancer or something like that, how do what's the process there of, you know, claiming liability and having it be sort of shown that's something that the doctors and, radiologists are liable for?
Well, in the case of where you miss it on the mammogram, that's pretty easy. You can, get mammograms that show, that everybody agrees this shows a cancer, and show how it's similar to what was on the, you know, our client's mammogram.
Okay, so you actually, like, would show examples of other mammograms and say, like, "Yeah, these ones all, show cancer, and this one's very very similar looking."
And, here's the criteria, what you look for to either say it's cancer, or say, hey, well, I need, it only has some of these criteria, not all, so we need further testing.
So if you do go forward with a, breast cancer misdiagnosis lawsuit, what are some of the potential damages that a plaintiff can recover?
Well, they're similar to other, medical negligence cases, lawsuits, in that you can recover for, whatever compensation is necessary to, to put you back in a position where you were before the negligence occurred. So in a case, that would involve death, it be would be called a wrongful death lawsuit, and the family could recover for the loss, of their loved one. If it results in not being able to work, uh, you could recover for lost wages or loss of potential earnings, over your work life. Whatever medical expenses that you would incur or would need in the future, all of those things can be recovered as compensation in a medical negligence lawsuit.